On December 24th, 2013, while life as we know it in the Caribbean would have revolved around the merriment and anticipation of last-minute Christmas preparations, many residents in St. Vincent and the Grenadines, St. Lucia and Dominica were far from cheerful.
We were hit by this unusual weather feature on Christmas Eve night into Christmas morning, and the health sector was affected negatively, particularly the main health facility, that's the Milton Cato Memorial Hospital, and one or two other health clinics throughout. We have several district health clinics.
The floods were triggered by a trough, which dumped excessive rainfall on St. Vincent in a 2 to 3 hour period, resulting in what was classified as a national level 2 disaster, with 9 persons dead, 3 unaccounted for, and thousands affected.
Over 10,000 persons who were affected directly or indirectly by this particular weather event. And people lost their homes, they lost their belongings. 12 inches of rainfall in 3 hours. People who were vulnerable became indigent. Who were poor went into a condition of dirt poor poverty. And those who were already indigent, well, they went into a hellish situation.
12 main areas were affected as depicted on this map, and damage and losses amounted to $108.4 million. The health sector in particular sustained damage and losses of $2,052,917. The country's largest health facility, the Milton Cato Memorial Hospital, was included in the critical infrastructure that sustained losses and damage. The impact at this 211-bed facility was significant, with 24 inches of water affecting the lower levels of the hospital. The Milton Cato Memorial Hospital is generally susceptible to floods because of its current drainage situation. But the level of flooding experienced in December 2013 was unlike anything previously witnessed at the facility. The unprecedented floods damaged or totally destroyed between 3 and 4 months' worth of supplies, records, and essential equipment, including the country's lone CT scan machine. The experience was nothing short of a nightmare, particularly for those on duty at the Milton Cato Memorial Hospital.
I saw this big gush of water. My God, I was so scared. There's this heavy gush of water coming down, actually going down to the pediatric area. So I thought to myself, my God, what is this? Where is all this water coming from? I must admit I did panic a little bit. But my first thought was the children on the ward. We couldn't actually get to the ward because the water was actually rushing in the front door. So we couldn't get in via the front door. And the ramp that was leading from male medical up to peds was also flooded. It was all soggy, it was wet, and there was tons of debris coming down, even incubators that was smashed, oxygen cylinders. My God, everything was just going into pieces.
Providing further insight into the extent of the impact at the Milton Cato Memorial Hospital, Health and Environment Minister Honorable Clayton Bergin said that the flood event significantly retarded the growth of the healthcare system. Though somewhat functional due to the ingenuity of staff, the damage to the autoclave represents a major setback, particularly because it is used to sterilize instruments for the district clinics as well.
We lost a lot of stuff. A lot of gauze, cotton, a lot of stuff that I had done prepare, sheets and so that packed to run and stuff. So we actually put up things and a lot of them get this mash up. Hope because send me autoclave, was grateful for that one. And a protective suit, how we lost that. You had one apron and that was in the mud, had a surgery.
The Pan American Health Organization PAHO has fulfilled his wishes with the procurement of a new sterilizing unit, which was installed in October 2014. The overall response to the disaster was immediate, and PAHO has been credited with being among the first on the ground.
The floods were on the Wednesday night, and by the weekend, PAHO was on the ground. So it's been excellent in terms of the immediate response to helping us with the assessments, the needs assessments, the bringing in water purification tablets, bringing in the expertise, doing the preparing the reports that we would need to get funding to get assistance, to the actual sourcing of equipment, replacement supplies. It's been tremendous.
Following the preparation of the initial health sector impacts report by the PAHO Emergency Health Response Team, several donors pledged support for the rehabilitation works. The response was significant. The recovery effort in St. Vincent and the Grenadines following the December flood event continues to be a work in progress. In addition to immediate relief and restoration of affected services, there is some emphasis on addressing existing deficiencies to mitigate future impact to the extent of what happened in December. 5,000-gallon water tanks have been procured and installed on elevated concrete platforms to boost the water storage capacity at the health facility. 3 more will be installed pending the completion of installation of connections and fixtures. The flood event highlighted a glaring deficiency in the storage capacity and the safety of supplies at the Milton Cato Memorial Hospital. As part of the emergency response assistance, PAHO procured 2 20-foot containers, which are now located in the same compound as the nurses' hostel and which is relatively close to the hospital. A drainage assessment was conducted to determine the cause of the flooding, and the subsequent report has identified both short and long-term measures to mitigate the problem. Having determined that the majority of the damage done to the hospital was to the electrical systems, an electrical assessment has also been undertaken and recommendations made for the creation of electrical drawings, as none currently exist, installation of a second generator, the elevation of outlets and small transformers above potential floodwater levels on the ground floor, upgrading the electrical wiring and the cables, and reducing the present energy consumption through the use of energy-efficient fixtures and possibly utilizing renewable energy. PAHO was able to provide the required mosquito larvicides, insecticides, and rodenticides, together with handheld and truck-mounted foggers, and the provision of a rented vehicle to support the increased efforts to limit the spread of these vector-borne diseases. The Public Health Department was supported to carry out public awareness campaign meetings to sensitize the public on vectors and their public health importance. Supply management SUMA training was provided for 43 persons in March to enhance the receipt, tracking, and distribution of relief supplies. The pharmacy unit at the Milton Cato Memorial Hospital and the National Emergency Management Organization NEMO have already started utilizing the program. Immediately following the impact of the floods, 60,000 chlorine tablets were also supplied and utilized in the early stages of the disaster, prior to the complete restoration of the public water mains. While the flood event and its widespread impact created a major setback for St. Vincent, there was reason for optimism in the midst of it all. The reason being the continued operation of the Georgetown Hospital, which had recently been retrofitted through the implementation of the Smart Health Facilities project funded by UK Aid and DFID. The fact that its operations were not disrupted bears testimony to the importance of the Smart Hospitals project, which seeks to promote a combination of safe and green intervention strategies, creating valuable linkages between their structural and operational safety at a reasonable cost-to-benefit ratio, and which allows them to balance their vulnerability to natural hazards and the potential impact of climate change, while at the same time reducing their carbon footprint. In addition to its uninterrupted operation, the Georgetown Hospital, through its newly installed water harvesting system, was able to provide water to members of the surrounding community who experienced disruption of their water supply. The situation as it stands now can probably best be summarized by the Health Minister.
And I must dare say that the nurses and all the workers, the doctors, they did tremendously well on that night to ensure the safety of the patients and other persons around. And the flooding really set us back at the hospital. And as I said before, many organizations, government, and PAHO indeed has come to our rescue, and we are not back to normal, but a semblance of normalcy is back.